Hello, welcome to Health Options, the program that not only tracks government policies on health, but helps you with the information you need to make your informed choices about your health. Thanks for joining us. I am Rabi Abdullah. We bring you the concluding part of the episodes on the task before the new administration in the health sector, taking the views of more implementers of the nation's health policies, experts, and other key players. If you're just joining us, this is Health Options, and on this concluding episode of our satellite, or the task before President Bola Ahmed Tinubu, we take a peep into the nation's HIV and AIDS situation. Let's now join the Director General, National Agency for the Control of AIDS, Dr. Gambo Aliyu Gumel.
In the past, we concentrate our effort at facilities. To some extent, our activity in the community were limited. After 2019, when we x-ray the epidemic in the country and we take a look at where the shoes were pinching the most, especially communities where HIV was spreading and higher than other communities, we realized the best way to go after the epidemic, as directed then, ANACA was directed by the former president at that time, to push for the last mile. We sat down and realized community is very important and community is key. Our services must now move, not only limited to facilities, hospitals, clinics. We must go to the community. We must bring the services near to the populace, at their doorstep, and we must find ways and means to improve uptake. This was an effort that started late 2019, and it reached the peak during the COVID-19 pandemic. We were out there looking for COVID-19 at the same time looking for HIV. People were offered different tests. As a result, we were able to resist the impact of COVID-19 as far as HIV programming is concerned, which to some extent affected countries worldwide. Only 6 countries survived, and among those 6 countries, Nigeria was top on the list. Yeah. So I think this is the result of what you've started seeing in Nasarawa, and I believe if you go to other states across the country, you will see the same trajectory. Several years or some years back, HIV was a problem at those communities, and people were dying from HIV/AIDS. Now, you hardly see someone in the hospital and occupying hospital bed because the person has HIV, or somebody dying because the person has HIV. If you see those cases, these are cases that either they don't know they have HIV, or they know they have HIV, but they don't want us to know. They didn't involve us. We are not far from the target. We need to look at our numbers, and we need to clean those numbers, because we're out massively looking for HIV across the country. Our data need to get clean and reconciled to see how many people we counted, and we counted them only once. There are no double counting. To know the exact number, as we are talking, that we believe one have HIV, and they are captured on our treatment. They're taking this treatment, and the treatment is making this virus to disappear in their blood. Once we have that exact number, after cleaning our data, we'll be able to say precisely how far are we from the global target, which is 95, 95, 95. And I was always saying, the target is to get 95% of people that have HIV in their body identified in any country. And 95% of those who have been identified enrolled on life-saving medication. And also 95% of those enrolled on life-saving medication achieving viral suppression, which means when you look for the virus in the blood, you do not see it. The virus disappears. The goal here is, if the virus is not seen, the virus cannot be transmitted. And if the virus cannot be transmitted, it cannot make the person sick, talk less of killing. And if it doesn't get transmitted, it doesn't get the person sick, it means it remains with the person. As long as the person is taking medication and lives with the virus in a symbiotic manner, without the virus killing and harboring or keeping the virus away from other people in the community. This is the target, the global target. Once that is achieved, then we have achieved, or we are at the verge of achieving, the end of what we call AIDS. There is a difference between HIV and AIDS. AIDS is the manifestation of HIV. It's the disease that has shown itself, and is the stage of the disease that kills. It's the one that makes somebody sick. HIV is presence of the virus in somebody's blood. What we want to achieve is whoever has HIV never experience AIDS. They live with the HIV in their body and they die with the HIV as long as a cure is not found. And if along the way the scientific community is lucky to get a cure for HIV, then that will solve the problem once and for all completely. For now, people can keep the virus with them without the virus getting out of them to affect other people, and without the virus making them sick, also not killing them. Donor fatigue should be expected. This is 20 years programming, and this is 20 good years receiving donation money from outside coming into the country to support our program. Certainly, this money that is coming will not continue to come forever. However, our donors are benevolent enough and patient enough to work with us and to support our programming until that time when we are able to identify everyone that has the virus, or close to everyone that has the virus in the country, and achieve the target of keeping the virus within those people that have the virus. Once that is achieved, it means the virus cannot be seen among people that do not have it. And it also means that the problem now will be giving or treating these people that keep the virus within themselves. And this is something that is going to be lifelong. At this stage, going forward, countries will be required to own the program. And this is what we call ownership and sustainability. If you realize the last 2 years, this has been one of the key topics that you see in our discussion, and you see when we have seminars and when we have workshops, when we engage with states, this is what we preach. It is time we put structures out there at the state and at national level for sustainability and ownership. And this is the reason behind the launching of HIV Trust Fund that you've seen last year.
In the Financial Act, there's what is called SSB tax, sugar, sweetened, and beverage taxes. Those commodities or those food items that have capacity to trigger healthcare conditions are being taxed, and the appropriate place that those resources should go, I think, should come to health insurance so as to provide health protection to the generality of people. So if the government prioritizes health, then all encumbrances that can militate against mobilization of resources for healthcare should be eliminated. When you take care of health challenges of your people and you reduce the out-of-pocket expenditure, you are indirectly lifting people out of poverty. So how can health be prioritized and be put on the topmost agenda? The new government should look at this document quickly and approve them and commence implementation, commence mobilization of the resources to cover the vulnerables. The framework for the implementation has been well elucidated in the state, by the creation of state health insurance agencies, by experimentation of this basic healthcare provision fund. What will it take? We know what is a premium that is required for an individual to get into the healthcare delivery system. So if the new government will look at the NHIA law, and be oriented on the various mechanism for bringing resources into the health insurance, especially through this health insurance levy that might come through the healthcare financing arrangement. Within no time, I foresee Nigeria moving in a right trajectory for attainment of universal health coverage by 2030. And mind you, one of the appealing features of the health insurance system is that the final destination of large chunk of the resources that has come to the national health insurance system is the hospitals. So through the funding that is coming through the national health insurance, hospitals can develop a strategic plan for development and improvement. As the monies are coming, they are using it to upgrade and expand the infrastructure and even hire more human resource for health, more infrastructure, more equipment, more human resource, and better services.
I think there's no other direction than upwards for this administration, because the groundwork has been laid in terms of making sure, for example, that for the first time in the history of primary healthcare, we now have a comprehensive national database of what every state has in terms of the infrastructure of primary healthcare, in terms of the number of primary healthcare workers that exist, the kind of equipment, the kind of health management information system, the logistics, the laboratories, all of the information that they need to take decisive measures around transforming primary healthcare is now available in a comprehensive database. What is also awesome about this roadmap to transforming primary healthcare, this document, is that it is a document that is not just written by government. It is a document that has been signed off by our donors and partners as the roadmap, as the way to transform primary healthcare. It's taken a lot of years, a lot of negotiations, learning from the past, standing on the shoulders of people that have come before us, now pulling all of this together, articulating it in a way that is compelling, in a way that is motivational, to say, this is how you get it done. whether it's health insurance, whether it is private sector involvement, whether it's the involvement of community-based organizations, what the governors need to do to get the job right. So we're very excited about what the future holds, because now we can see clearly that there is progress that is being made. So for the first time in the history of Nigeria, we have 8,000 primary healthcare centers enjoying on a quarterly basis right around 300,000 naira from the Basic Healthcare Provision Fund, making sure that they have resources to be able to maintain the services that are required in the health facilities. Some 25,000 primary healthcare centers across the country had never had this kind of steady inflow of resources. Now we're bringing them back to life. And it's not going to happen overnight that you see suddenly that you have a 5-star primary healthcare center. No, we're moving gradually but steadily towards a situation where you can move into a primary healthcare center and then you'll be glad, you'll be confident that you have the best treatment that you can because of the quality of the human resources that are available.
A new administration, no doubt, provides new opportunities for policy redesign. Let's hear the views of both health experts and the ordinary Nigerian.
Issue of primary health care in Nigeria is very important to every Nigerian, and if the new government should be able to take it serious, why is our nurses leaving? So they should consider it, probably because they are not getting paid well. They are not being paid well. So I think the Nigerians, the new government, should look at it. Look at what are the areas, what do they really need? Probably have one-on-one discussion with them. Then look at how to fix it. Because with this, people can be able to stay. Because we can't leave. Our best medical personnel should not leave the country. Because when they leave the country remains as if. Probably, are they going to be inviting a new doctor outside the country or from a neighboring country? So I think it's very, very important by engaging with them, discussing with them, then know what is the problem. And if possible, fix it, right? Because that is what that's all we're asking for. And that's what every Nigerian is asking for.
Considering our health sector, I don't think that it's in a good shape at all. Because most of our doctors are running out because they are not paying them well, and which they need to pay them well because their work is a professional work, and it has to do with human life. So they need to be paid well so that they can be focused to do the job. That's why most of them are running out, because they are not paying them well. Then come to the area of primary health care. They are lacking a lot of equipment in the hospital. No good equipment, no good drugs. So we advise this present administration to do something about it.
Everyone is talking about the priority of the primary health care, so that every Nigerian can have access to functional health within very short distance. So we have Nigeria well mapped out geographically, and even we have political mapping that is convenient for any Nigerian to get to any of the political points. So if we endeavor to have functional primary health care in each point, I believe the health indices that are poor presently will become better. The low-hanging fruits has already started with the exchange rate that is trying to make a single one. Of course, the issue of the big elephant in the room, which is the oil subsidy, which he has also attacked. And I'm sure the issue of leadership in the various institutions, parastatals, and government offices, because everything is about leadership. By the time you inject purposeful leadership in all these institutions, you start seeing progress in every area of the country.
The new government that's already here, what we will say is health has traditionally not been a priority. The COVID-19 pandemic, if anything, showed us the critical importance of health. Traditionally, there has been a great focus, understandably so actually, on things like security, on the economy, because of course these are critical engines for the country to move forwards. But if health is not addressed, if we do not prioritize health and ensure it requires the necessary funding, the capacity, attention, that all Nigerians have access to quality and affordable health care. As a country, growing as we are, we're over 200 million already and projected to grow to over 400 million by 2050. It only takes a government not to focus on these things and know that the repercussions will be severe. Because if we're to compete with other countries, if we're to grow, if we're to say that we are the giants of Africa, we cannot achieve these things if we do not focus and prioritize health.
And there is no way that we are going to be able to solve the problem of malnutrition in a sustainable way without also engaging and solving the problem of climate change and sustainability in a sustainable way. So for us to be able to make progress with both, we have to tackle both of these areas together. And it's important because there's so many impacts that our food system has on the climate. 70% of all water withdrawals from fresh water is actually is used for the food system. About 40% of arable land that we have is used for the food system. And in spite of all of that, 40% of the food that we produce is either wasted or lost, which again contributes to climate change. So we need to understand that these two systems are so connected that we have to tackle them. So there are many things that we can do. First of all is, as a government or as a people, we need to really bring policy together. Some of this is happening already. The Ministry of Environment is championing work under the Climate Change Act. The Ministry of Agriculture is, they've set out a agriculture sector food and nutrition security strategy. The country itself has signed up to a national food systems transformation pathway, which brings not just solutions for food and nutrition, but also climate. So there are all of these things already in place, and it's really about making sure that they work. And how would that work? We need to build capacity at national level, at sub-national state level, especially, so that the policymakers can engage with these issues. But also we need to fund what's going to happen. And so the way that national planning and budgeting is done has to support the actions that need to be taken, already set out in many of these documents, to address both climate change and food security and nutrition security. Many of us partners, like the Global Alliance for Improved Nutrition, other partners are ready, we're willing to support and help to ensure that we're able to deliver this for our people.
In summary, in order to create the health sector of our dream, one that every Nigerian deserves, government must prioritize primary health care, address health worker retention, sustain epidemic preparedness and response efforts, ensure adequate financing for healthcare, as well as implement policies and make investments in employment, healthcare and education by way of dealing with the nation's rising population. That does it on Health Options. You can go to our YouTube channel to watch this and previous episodes of the program. I remain yours, Rabi Abdullah, Thanks for watching. Hope to see you again. Until then, do stay safe.